Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone, and thanks very much for joining us. First, the excitement and the promise of the COVID-19 vaccines. Now, the frustration, the confusion of who gets it, when, and where. And that's where this edition begins. We are joined up top by Dr. José Romero, Secretary of the State Department of Health, Dr. John Kirtley, Director of the Arkansas Board of Pharmacy, and John Vinson, Ph.D., Vice President of the Arkansas Pharmacists Association. Gentlemen, doctors, thank you very much for being with us. Dr. Romero, let me begin with you. There does seem to be across the state, at a minimum, confusion about where we stand on the immunization. Now, we're getting the states allocated something in the neighborhood of a bit less than 40,000 doses a week, my understanding, of one or the other of the vaccines. But sometimes the message doesn't seem to be reaching the intended audience, and the intended audience isn't always hearing it.
That's correct. Well, thank you for having me again. So we are receiving about that amount of vaccine each week. It's an allotment that we asked for. We are currently distributing that vaccine through our partners, the pharmacies, community pharmacies in the area. We originally had targeted the high-risk individuals, that is, those individuals at long-term care facilities, the staff there, as well as our healthcare providers, and that has gone, I think, reasonably well. We can talk about what were some of the issues in that, but I think that right now the biggest issue, and what I'm hearing more and more often, is that persons don't know where to go to look to see where they can register. We ask them currently to check with their pharmacies to see if they're giving the vaccine. And for educators, those are individuals that are in the education area, especially in K through 12, they should be checking with their school districts for where to go for vaccine. But for the 70 plus, which is the other high-risk group that we're now in phase 1B, we're relying heavily on the pharmacies themselves.
Well, in terms of the 1A target audience, how effective has that effort been?
So we think it's gone well. I don't have granularity as to the percentage of healthcare providers we've immunized at that point. We're getting that now. We've really been concentrating on getting the vaccine out. So we need that data. We need to know how much vaccine has actually been delivered and how it's been accepted in the long-term care facilities, that is, the residents and the staff that take care of them. And then we also use that phase 1A to deliver to first responders. So we need that data. It looks like we're doing okay. So let me give you some general data. As of this morning, we had distributed about 54% of the vaccine that had been allotted to us. Last night, when I looked at the CDC distribution chart, our distribution per capita is among the highest in the southern area. Of our contiguous states, only Oklahoma has a higher rate. And if you look at below the 36th latitude, it's Oklahoma and New Mexico that are ahead of us. So we are doing well in the distribution of this vaccine. Certainly, we'd like to get it out to a larger number of individuals.
Okay, to Dr. Romero or to either of our pharmacy representatives, is there concern in the clinical community, yourselves included, certainly, about a resistance in the target groups to accepting the vaccine, to taking advantage of the vaccine?
I'll take a shot at it. Go ahead, Doctor. Go ahead.
Yeah, I would just say that, and I'd love to hear Dr. Romero, Dr. Kirtley's response to that as well, but in the current phase in the community pharmacies for the patients over age 70 years of age, there's a very high demand and much less hesitancy than what we were concerned about with it being a new vaccine. I'm hearing from the field that greater than 90% of their patients are wanting the vaccine and willing to receive the vaccine in this 1B phase for the age 70 and over. And remember, that patient population remembers polio. They were kids when the polio vaccine was released back in the late 50s, early 60s, and they are really big believers, and the virus in that patient population is also the most devastating. There's a higher risk of severe illness, and they're very, very interested and willing to be vaccinated.
Okay, you mentioned that a segment that remembers polio. There's another segment of Arkansas, of the nation, that remembers Tuskegee. So I have to ask if you have detected a continuing reluctance or suspicion, skepticism in communities of color, particularly our African American communities, about the vaccine.
So let me answer that both at a national level and local level.
Sure.
So clearly the studies have been performed, and as many as 60% of African Americans have indicated some reluctance or total reluctance to accepting the vaccine. Within the state, they are a high group which has demonstrated or has really voiced reluctance with regards to accepting the vaccine. The other group that's also important are the Latino population within our state. I've personally been involved and have heard of these concerns from the Latino population. It is our job, that is the job of those of us who are delivering the vaccine, the health department, to effectively communicate about the safety and efficacy of this vaccine. One thing I think that we can stress is that these vaccines have been studied in the target populations, that is, in Latinos and in African Americans. We know that those studies included significant numbers of that population, and that it was shown to be effective and safe in those populations. And that is what I always try to stress. For those populations, that vaccine has been studied.
Dr. Kirtley, Dr. Vinson, do you anticipate that our pharmacies in Arkansas will continue to be, or will continue to be the focus, the locus, if you will, of immunization in Arkansas?
You know, Steve, I think that one thing that's been a point that's has been said many times is almost every community in the state of Arkansas has a local pharmacy. We are, in many ways, the most accessible healthcare professionals for many people in the community. And I think that they will continue to take a very active role. We have a couple of hundred pharmacies on board right now that are actually receiving vaccine and are out dosing those. Dr. Vinson can outline those numbers specifically. But what he and I think would both tell you is there's a whole nother list of pharmacies that are ready to get this vaccine and ready to provide it to their customers. And the other thing I can tell you is every pharmacist and pharmacy I have talked to as of late is just absolutely inundated with phone calls. It is breaking phone systems and shutting down phone lines in these stores because people are so adamant that they are ready to get this vaccine and want to know when and where they can receive it.
What about supply? Yeah, gentlemen, I don't want to cast this in a political sense, but just this morning we received, and I'm not asking you to comment politically, but this from President Biden's team, quoting this morning regarding the COVID situation, that the Trump team had failed to share crucial information about supplies and vaccine availability. Ergo, the situation, quote, is so much worse than we could have imagined. Now, Governor Hutchinson himself has repeatedly expressed frustration over the past year with the absence of coordination from Washington. Are you seeing that manifested now at the ground level, at the granular level in Arkansas?
So,
Kirtley.
Let me take a crack at that. And again, I don't think this is political in any way. It is, the facts are the facts. So we were promised a second supply of vaccine that was promised to be 50% that was held in reserve plus a 5% contingency reserve. And within a matter of days of having Mr. Azar announced that he wanted to expand the groups to receive the vaccine, we learned that vaccine supply did not exist. So all of us were of the mind that there was another set of vaccines that were in reserve and could be released when necessary. So, that's not political. That's the fact. If other issues are when this vaccine was originally released. I mean, it was released before two major holidays. And those are holidays in which, you only have a limited number of days in which to distribute that vaccine. So there were flaws, I believe, in the distribution of this vaccine, and it could have been better executed.
Dr. Kirtley, Dr. Vinson, do we have vaccine in Arkansas? Have we experienced in Arkansas vaccines that have gone unused either because they've been dated or a failure to participate?
I would say in the community pharmacy setting, and Dr. Kirtley can add too, we have not heard any reports of the community pharmacies wasting doses, throwing any in the trash, or having doses expire in our community pharmacies. We did start with 212, Steve, because 212 represented 73 of the 75 counties, plus a collaboration with a local health unit and a local rural health clinic, physician clinic in one of the counties. And 212 is the boiling point of water. And we are bringing the heat to this virus with the supply we have. We are getting consistent supply, Steve. And what I mean by that is we know how many doses are coming per week. We have the vaccinators, we have the capacity, and we're making sure that patients in Calico Rock receive vaccine in an equitable fashion, the same way a patient in Pulaski County or in Little Rock might receive the vaccination. And that's partly because of this, or mostly because of this public-private partnership with the governor and the health department.
There is also concern, gentlemen, doctors, about the ancillary equipment and shortages there. Syringes, for example, sterile needles. Are we experiencing that in Arkansas as well?
So as of last night, the supply that will come from the federal government will have sufficient needles to capture even the 6th dose of Pfizer vaccine. So to date, I haven't heard that there is a specific deficiency of any of those, and I'll defer to my colleagues to see if they have heard specifically about that.
All right, gentlemen.
Well, I would say that from the regulatory side, we have seen some questions that people are worried that if the supply does not keep coming at the steady rate that it has, and also calculating the fact that there are additional doses in these vials due to overfill, there are pharmacists that are concerned that they will not be able to get the specific syringes that they need. There is some technical issue with some syringes that actually just work better when drawing up vaccines than others, and that's the supply that we want to have.
Gentlemen, I should advise the audience that for several reasons we are conducting this conversation on a Thursday morning. The new president is to address the nation, we're told, Thursday afternoon regarding his administration and the coronavirus. I would ask each of you if you could ask for 1, 2, 3 things from the new administration regarding the virus, what would it be? Dr. Vinson, let's start with you.
I would say whatever resources that the new President Biden has and his team to help the manufacturers to ramp up any manufacturing areas that they may need assistance, to working with the other manufacturers that have vaccines in the pipeline, to remove any barriers to those being their data being brought to the FDA and eventually the CDC for review to make sure we're able to get a 3rd or a 4th vaccine approved in the near future, and to also improve the communication so we know reliably what's coming, how it's coming, when it's coming, and how much is coming.
Dr. Kirtley.
I would echo exactly what he said. The Board of Pharmacy especially has long taken an approach of a couple things. One of them is largely education. We have got to educate and we've got to communicate. The biggest thing is if you've got vaccine accessible through the federal government, by all means, get it to us. If you get it to Arkansas, we will take care of it.
Dr. Romero.
So I echo all what has said. First of all, we have built an incredible vaccine or vaccines in a matter of 10 months. As I've heard of a colleague of mine call it, we built a Cadillac, but we need to distribute that Cadillac. So we need funds, we need support to get those vaccines into arms. And that means the federal government needs to provide the states funding so that we can get the individuals necessary to get that vaccine out. Second of all, we need to have clear messaging from the federal government about how we should approach this issue when possible, giving us as much detail as possible. And lastly, openness. We cannot have another debacle like we did with regard to what was expected from vaccine. Keep us informed. We can deal with the limitations, but we need to know what those limitations are.
All right, doctors, thank you very much for your time. I fear that we are now out of hours. Thank you so much for being part of the program. Come back soon. new session of the General Assembly with some new faces and both chambers overwhelmingly Republican. Does that necessarily mean smooth sailing for a Republican governor facing his final General Assembly? And an all-Arkansas Republican congressional delegation now confronts not only a Democratic House and Senate, but a Democrat in the White House. Well, to hash it over, we welcome back consultants Bill Vickery from the right, Michael Cook from the left. New year, new decade, first time back on our air. Gentlemen, thanks for coming back in. Let's start with the General Assembly. We're in week 2 now, wrapping up week 2. It's the final regular session, Bill, for a Republican governor. But that doesn't, as we mentioned, doesn't assure him necessarily smooth sailing.
Yeah, I think everything's a family fight now inside the Republican Party. And, you know, typically governors in there that are term limited, that are in their second term, I mean, this is Governor Hutchinson's last official full legislative session. You know, it can get a little dicey for those folks, but I got to tell you, I think the leadership in both the House and the Senate and the governor's office seem to be working fairly well together. I do get the real sense being up there. There is everybody wants this to work out. So there's a lot of folks who are putting a lot of skin in the game in terms of having a somewhat of a smooth legislative session. And some of that has to do with the fact that we're all stuck under the same protocols in terms of safety and the virus and things of that nature. Nothing like operating the government in a global pandemic to kind of make things cohese a little better.
Well, certainly there would appear to be some intra-family fights going on there, Bill, certainly on the Senate side, on the south end of the Capitol.
It is. I think you've got some strong personalities in the Senate and folks that have been here for quite a bit of time, especially in our term-limited world, that all want. My sense is, you know, you got folks who all want to do well. They just come at it from different perspectives. But I think at the end of the day, the Senate will smooth things out. You know, the House typically is the one that's, because of the large number of members, it can be a little bit scattered. But in this case, the House seems to be all sort of unified together. The Senate, though, listen, Steve, I think I'm strong personalities, but they all want to get stuff done. And I think they're all aware of needing to get stuff done for the state. And I think that wins the day. That wins the day in the end.
Michael Cook, on your side of the aisle, on the Democratic side of the aisle, you're facing supermajorities in both chambers, stronger than ever. The Democrats' ability to shape the agenda is pretty limited.
Yes, that's correct. You know, the Democrats in the House and the Senate are in as you mentioned, the super minorities. So, frankly, the Republicans have the run of the place. They get to vote up or down on anything they wish. In the past, in the previous sessions with Asa Hutchinson and the Democrats, where there were just enough of them where Ace could go to them, or the Republican, even some of the Republican leadership, and ask them to either pass certain things or, frankly, kill some things quietly in committee that they didn't want to get out. But now that Democrats just don't even have those numbers, they are unfortunately have been put to the side. So, frankly, the action is going to be on the Republican side, which, you know, as you mentioned earlier, we're just getting started in this session, and like all legislative sessions, they start off very slow. And then start getting geared up. We have some big fights looming ahead. You know, we're currently the Stand Your Ground is going through the legislature. The hate crimes bill that the governor Asa Hutchinson is proposing is going to go through, or at least going to be considered. And then we have future fights over potential voucher bills and other COVID-related things. So I think while the Democrats will not have too much say this time around, I think what you will see toward the end of the session will be a lot more GOP infighting, kind of what Bill was alluding to on the Senate side with a lame duck governor. People are they're just sort of, you know, they want to do their own thing. They want to reassert themselves. So these fights are around the corner.
Right. Well, what you mentioned, Bill, or Michael mentioned the hate crime. So let's take that up, Bill, because it is something that Mr. Hutchinson in his address to the General Assembly said, I very much want, and the resistance is plainly there.
Yeah. Hey, listen, he's going all in on that legislation. There's no doubt about it. There are some very sober, smart, well-meaning people who have some issues with it in terms of what all gets caught up in defining things. And I think for the bill, the devil really is in the details for a great number of members who want to see a lot of kind of how are we going to define X or Y or Z, or should we open it up or should we narrow it, things of that nature. And like any legislation, listen, it's going to be debated out in public. I think members don't have a fear of talking about these kinds of things in public. And at the end of the day, I don't know. I'm not much of a gambler, Steve, but 50-50, maybe less than 50-50 for the governor to get this passed. Again, I think it really all boils down. Let's put it this way. It would not shock me to see the bill amended 2 or 3 times before it passes out.
Well, according to its sponsor, that is totally unacceptable to him. And I think basically, well, it might be ethnicity and race to some extent, but the real big hang-up would appear to be gender identity and sexual orientation. Or do you read it another way, Bill? Michael?
No, I tend to think you're right. I tend to think that, again, we're getting into, for a lot of members, I believe, classifying people in certain ways. Do you create specialized classes of folks who get treated differently than others? Equity amongst in the law for everyone. These are just a few of the things that are going to be kicked around. Will there be some outlandish arguments? There's no doubt about it in my mind that we'll see some outlandish arguments surrounding this. But there are, listen, sponsor's a good man, smart guy. Governor's a good man, smart guy. They come from the same family. And you've got folks on the other side who are smart, well-meaning people too. I think at the end of the day, they'll get their heads together, and we'll get something worked out on this particular issue. I think the business community weighing in probably will have a big impact on it as well. But again, a lot of members out there who are rational, reasoned people, down-to-earth folks that have some problems with it, and those are going to have to be addressed.
All right, let's go federal for a second. Michael, your party has reason to celebrate, if on the Senate side, barely.
Yes, yes. On the 20th, we had the inauguration of Joe Biden as the new president of the United States, number 46, and then on the same date, Democrats took over the U.S. Senate, and now they control the House, the Senate, and the presidency. So they are now in control, and hopefully we will see some new movement to kind of heal the wounds of this country. First and foremost, most importantly, hopefully now we will have a plan to fight COVID. What has happened for quite a while since this whole thing started is that the states had to figure it out themselves. And now that we have a vaccine, it seems like we've been in the same boat where all these different states trying to figure out, Trump just sort of gave up. And now to have a president who's put this on top of his agenda, who's putting out a plan on how to get this vaccines in people's arms, how to lower the rates of infection by emphasizing and really stressing the importance of masks and social distancing. I think that's going to go a very long way to solving this pandemic. But of course, it's going to be a while. I mean, let's not fool ourselves. This is not because we have a new president and the Democrats control both branches of the House and Senate, then all of a sudden it's going to be magical. This is going to take a while to get where it needs to go, but at least we have somebody in charge who has a plan and is working hard to implement it. Well,
back to Bill, if I may, for a second, because what the inauguration of 46 has meant is that the junior senator from Arkansas appears to have a fairly clear, but not a clear path to the nomination, but certainly he does not have to be concerned about about what's going to happen in 2024.
Yeah, listen, I think politically Tom Cotton has played the last 12 months perfectly. I think he came out and was very strong and forceful about the end of the election and moving on, and an unwillingness to fight the results. And we see, I think that's paid political dividends. But at the end of the day here, he's now constantly mentioned. He's one of 2 or 3 guys that are always going to be mentioned as presidential candidates 4 years from now. He is in demand. I think you will see him popping up in Iowa and New Hampshire, South Carolina. You'll see him raising money. He very much has a golden boy status inside the Republican Party at the moment because he has a foot in both worlds. He can speak confidently to the millions of Trump supporters that do dominate the Republican Party. There should be no doubt about that. But he also, within the business community and within the Business Roundtable and others, the more traditional Republican community from the past, I think he's very well respected there as well. So if there was one guy that was looking forward, I think, to the new administration and the ability to be the vocal counter to the administration, that's the other thing. A lot more airtime for Tom Cotton in the coming days. And
well, let me go to Michael now, because he gets the last word, and we're down to a few seconds. Michael.
Well, I think Cotton, of course, is trying to position himself for 2024. But we just had a president who is incredibly flamboyant, Donald Trump. He's a showman. And to me, it's, again, Vickery will know more about the GOP primary than I ever will. But it seems like that's what Republicans want. They don't want Cotton is so wooden, so stiff. It seems like they want more of the Congressman Matt Gaetz or the new Congresswomen, Marjorie Taylor or Lauren Boebert. It seems like those
now,
are the type.
Now you're really pushing it there.
I know it sounds crazy. That's where the party is headed. They love the flamboyance. They love the showmanship. And I think Cotton's stiffness and woodenness is, he says all the right things, but I don't think he has the red meat that the Republican primary voters, they love Trump. And I think they want another Trump, and I just don't think Cotton fits that bill.
All right, guys, both of you stay close to the phone. I have a feeling we'll be calling you back soon. Right now, we're out of juice, or we're out of time. Thanks very much for joining us. As always, see you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.